My name is Dr. Paul Sobkin. I'm an interventional radiologist and the clinical section head of angiography and interventional radiology here in Victoria. Interventional radiology may not be a subspecialty that you've heard of before, but it is one of the pillars of the modern hospital. Every day, my colleagues and I use sophisticated imaging equipment to support nearly every department in the hospital. The workhorse of our specialty is the Interventional Angiography System. It's a specialized X-ray system that allows us to see inside patients into the blood vessels and the internal organs, and it provides us with guidance to perform our procedures. These machines help us treat a wide variety of medical conditions, including stroke, renal failure, liver failure, clots in the arteries and veins, osteoporosis, infertility, uterine fibroids. I can go on and on. Steve Palen had chronic hepatitis C, which makes him prone to developing liver cancer. Liver cancer is one of the fastest growing cancers in Canada. When Steve initially developed liver cancer, we treated him by placing needles into the tumors and injecting them with alcohol. This would kill the tumors, and he would have a period where he was free of cancer, but eventually they would recur. Eventually, when alcohol injection wasn't successful, we treated Steve with Transarterial Chemoembolization, or TACE. In this procedure, we would place a catheter into the liver arteries and identify the blood supply to the tumors. Then we would fill those arteries with chemotherapy and block them off to deprive the tumors of their blood supply.
When I met Dr. Sobkin, right away, I liked him. I didn't notice at first that he had wings or a halo, but I know he does. And it was a bit of a shock for sure. Through his guidance and with his explaining the differences and the options that were available, he set me on the right course, got me into the liver transplant clinic, and changed my life, saved my life.
This equipment is over 13 years old and has been in daily use and is in urgent need of replacement. Buying a new interventional imaging system now is like upgrading your computer after 13 years. What you're getting now is completely different than what you would have got 13 years ago in terms of speed, resolution, power. And the new imaging equipment is going to allow us to see smaller and smaller blood vessels, which will allow us to treat a wider variety of patients with greater accuracy. These new imaging systems are able to provide the high-quality imaging that we need with up to a 60% reduction in radiation dose, which improves safety for both caregivers and patients.
I'm very grateful for the equipment that was available down here that allows me to be here right now. Both my wife and I have lost spouses. I've lost a brother at a young age, and we understand what that can do to a family. And we're very fortunate that that hasn't happened to this family now.
We didn't admit to each other that possibly he wouldn't be around. Everyone was so wonderful here helping, especially Dr. Sobkin. He'll always have a place in my heart.
First time I saw Dr. Sobkin after my transplant, I was playing a gig down here in Victoria. After the first set, I came off the stage and there he was, and it was just like, there's the angel.
We're so excited by this new technology and what it's going to be able to do for the people of the island, and we very much appreciate your belief in us and your support, which is going to help make this possible.
We never know when it's going to be your child, your grandchild. Everybody wants a chance at life. Please, give generously.